everyone, and welcome. I'm Kim Douglas, and I want to welcome you today to Your Healthy Dose. I am very, very excited about today's episode. I have two special guests here, and the topic today is very important to me on a personal level. We're talking about breast cancer screening and treatments. And without any further ado, I want to introduce you to these two fabulous women of power and strength and intelligence and that are just single-handedly, I feel, changing women's health. So first off, I want to introduce you to my dear friend, Dr. Tiffany Grunwald. She is the director of the Women's Health and Wellness Institute at St. John's Health Center. She's also internationally recognized as a surgeon and has worked extensively with breast cancer survivors, like myself, to restore their natural breast shape after mastectomies. And also, I want to introduce you to our second guest. This is Dr. Janie Grumley. She is the Director of Comprehensive Breast Program at the Margie Peterson Breast Center at Providence St. John's. She's a surgical breast oncologist who specializes in breast conserving surgery and intraoperative radiation therapy.
Yep.
And that is a mouthful.
It is.
Do you say that every day? When people say, like, what do you do?
Yeah, exactly. No, I usually abbreviate most of that. So.
Yeah, you're going to have to teach me the abbreviations.
There you go.
So let's dive in. You know, this is a topic that's really close to my heart. Breast cancer is something that I dealt with personally. And I remember hearing the words, you have breast cancer. And it really is true. Like, I just didn't have time for it.
Yeah.
I really didn't. And I know you two are busy moms and wives and doctors and surgeons and running health centers and living your life. And it's like, when you hear those words, it really just throws you into a tailspin. Not to mention that I really felt like, and I talked to a friend, Julia Louis-Dreyfus, who helped me through it. And she said some words that stuck with me. And that was when she got told she had breast cancer, her first thought was, why me? And then as it went on, she thought, why not me?
Yeah.
Why not me?
Well, I think it's one of those things where, you don't feel sick when you have breast cancer. And that is the hardest thing that I think most of my patients will say is like, I don't feel like I'm sick. What do you mean I'm sick? What do you mean I have cancer? And it's because of detection, right? And that's what I kind of have to remind them all the time, is that you realize that we are detecting it so early that it hasn't impacted the rest of you at this point in time. And so I think, digesting it is really difficult because you haven't been feeling bad for weeks and weeks, and then you get this diagnosis, right? You are just going in for your regular screening for most patients, and then you get a call and it's just throws you completely for a loop because you don't know where to start, you don't know what to do. You're just kind of frozen in time when you hear the word cancer, right? And so that's so important for patients to understand that there are good places to go. How do you pick where to go? Where is it that you need to go next? And that's part of what we've tried to build at the Margie Peterson Breast Center is, we don't want to help you just when you have cancer. We want to start when you're healthy. So, the first thing that I usually, tell patients that they don't realize there's what's called a breast health clinic at the Margie Peterson Breast Center. So that means, for most patients, if you wake up, if you feel a lump or have a concern about your breast, you have to go make an appointment with your primary care doctor. Then you have to go and get your imaging. It can take weeks. And during that whole time, you're either worried about breast cancer or you're not, focusing on life because you have this preoccupying thing. And so having this breast health center allows women to actually just call and be seen within a 24-hour period and get imaging done within that short period of time. And so many women don't even realize it exists, right? You don't even have to call your primary care doctor. You can actually call the number and just be seen because it is a primary care provider who can do your entire breast assessment. It's a breast specialist. Because the thing is, 80% to 90% of the time, it's actually nothing, right?
Oh,
and most
news.
of us, it's usually good news,
yeah.
right? So it'd be nice to actually hear about that, 3 weeks in advance so that you're not worried about it the whole time. However, if there is something that's happening or if there is something to be concerned about, that's where you can be plugged right into a comprehensive center, which is what you want to have at your fingertips.
That's so important. I've actually had just recently several girlfriends of mine, they happen to be fairly young, 30, and they said the worst thing was that time frame of
Waiting.
we had our mammogram, we found out we have it. Now what? You know, and that waiting. And Dr. Grunwald, what about you? What do you say to your patient after they're diagnosed? What would your...
And I think exactly what you said. It's it's a seismic event in someone's life, and I think the mind sometimes goes to the worst. And I think giving hope and a clear picture of what this pathway is going to be like for them, and that there is something on the other side, and that we have a great team at St. John's to really take care of everything that needs to happen for this, whether it's surgery or chemotherapy, radiation, reconstruction. I think that's a huge part of it. And then also, the life after surgery and getting back to, as we said, breast cancer happens to healthy women. And so getting women back to a healthy place where they feel good in their bodies again. It gets changed. Anytime that you operate on someone, you change the anatomy and how it feels. So I think that whole comprehensive offering at St. John's is really amazing.
I agree. And you had said the options, surgery, radiation, chemo. You agree? Is that pretty much the options that women have?
Well, I think it depends on what you have. And that's the biggest misconception. I think that most women think when they get that diagnosis, they think, I'm going to lose my hair. I'm going to have chemo. I'm going to do all of these things. And the thing is, the reality is we don't have to do most of that. It really depends on what you have. It's not one disease. Breast cancer is not like one thing.
One size fits all.
It's not one size fits all. It's very different diseases. And we have to figure out exactly what it is that they have for us to actually come up with a really good plan when it comes to what's actually needed for treatment. And there is a lot of misconceptions about what's absolutely needed. Because of the word cancer, everybody thinks bigger must be better. I should throw everything, including the kitchen sink, at it, right? But the reality with so much research that's happening nowadays and the amount of money that's poured into breast cancer research, we're finding out that less sometimes is actually all you need. Right. And it's trying to pinpoint exactly what you have. Right. So there's so much more than the size of the cancer, the type of cancer, the estrogen receptors. Now there's molecular things that we need to figure out about your cancer to see if you even need to have any chemotherapy. So it's so much more refined when it comes to trying to figure out what the patient needs. And I always do tell patients, you really don't want to overtreat a cancer and you don't want to undertreat a cancer. Right. So you have to figure out with the tools that we have available today, what exactly it is that you have and what it is that it actually needs. And so going to a specialist will allow them to have that kind of opportunity to figure out how to right size their treatments.
That's so important. And, with me particularly, I love what you both said because it even morphs when you first hear about it, because my first diagnosis initially was stage 0.
Yeah.
And they said no chemo, no radiation. Yeah. And then when Dr. Grunwald went in, everything changed and I came out after surgery with 3B. So, I love that you said that there's options and they all morph and change as you go on. And that leads me to you, Dr. Grunwald. So tell me about reconstruction options.
And I think that there are so many. And again, it depends on what the surgery is that you need. Right. And that can be anything from a lumpectomy to a mastectomy on the cancer side to bilateral mastectomy on both sides. And our reconstructive options are dramatically improved from what they were, 20 years ago. And so, it's everything from using your own breast tissue to reconstruct the shape of the breast, which when that can be done is a great option. To restoring the size of your breast with implants. And then if there's a mastectomy, reconstructing the breast with either implants or your own tissue.
Right. This is something interesting that a lot of my girlfriends talk to me about, whether they've had cancer or not, is the silicone versus saline implants. So is it still a big debate among women? I know for my friends it is. How about with you too?
Yeah, it's not as big of a debate anymore. Whether it's silicone or saline implant, what your body sees is a silicone shell. So it's there is no difference in what the body sees with either of those. The difference is, and it used to be when the silicone was liquid, when there was a rupture, the silicone could travel within the tissue planes of the body. Now the silicone is all, the molecules are all cross-linked, so it's cohesive, it's gel, gummy bear, there's all kinds of words that people use. So we don't really have that same risk that we did with the implants 15 years ago.
Oh, good to know.
Yeah, and
Good
the implants, now have a 20-year warranty, so patients can keep them in 20 to 25 years.
Oh, that's good to know. My next question was the lifespan of the implant.
Well, there you go.
So yes.
Much better than before.
Yes, exactly. Not our mother's implants or surgery, if you will, because I remember
Definitely not our mother's surgery.
No, my mom's friends were like, you just feel, I don't even want to say the word, but it just was a lot different, and their bodies never.
Yeah, and even, still in the United States, about half of women aren't offered reconstruction at the same time as their cancer surgery. Mm-hmm. And so not only can you have a breast reconstruction specialist do your surgery, but there's a lot of surgeons like Dr. Grumley who have some knowledge of plastic surgery techniques and incisions. And so they can do oncoplastic surgery for some of the simpler reconstructions, which just makes it so much nicer.
Yeah. So we're going to move into St. John's style of treatment. And again, for me personally, it was perfect. I want to discuss with you both, and this is very important to me too, the maternal versus the paternal approach to treating patients. And my question to you is there a difference? My answer is yes, resounding. So I want to hear from both of you, and then I want to share.
Yeah, so I coined that term a lot with my fellows. We talk about this a lot, because paternalistic approach to medicine is like, I'm going to tell you what you need, right? So you have cancer, you need to do X, Y, and Z, and that's it. And you hear that a lot from patients who get second opinions, is that I was told I need to do X, Y, and Z, and that's it. And then you come and have a second opinion with us. We spend a lot of time talking about all the different options, right? There are options for everyone. I tell patients, we're never going to tie you down and tell you, this is what you have to do. There are options, because there are risks and there are benefits to every single option, right? And for patients, it's more important to be like mom and kind of explain everything and kind of walk down each, path and try to figure out what is the right path for them. Because I'm not the person that can tell them that. Right. They're the ones that have to live with the decisions that they make. But in order to make those decisions, I have to educate them on what is that risk and what is that benefit and how is it going to feel, and walk through it with them, right? It's not an absolute that everyone has to do everything.
Right.
Right. And it depends on where you are in life. It depends on your life circumstances. It depends on what's, valuable to you. Some patients will do everything under the sun for a 1% benefit, right? They'll take chemo. Yes, even if it's a 0.5% benefit, I'm going to do it. But some people, they'll say 20% isn't enough for me to do chemo. And it's important to just kind of walk through those choices so that patients have a very clear understanding as to what they're signing up for and what are the consequences for each choice, so that they can actually make a really good choice for them. So I think, it's so important when we talk about a comprehensive breast center, is that everybody has an opportunity to talk to them about each thing. So we have what's called a multidisciplinary breast cancer clinic. So when you do come in for your very first consultation, you see a surgeon, you see a radiation oncologist, and a medical oncologist. And then we meet as a group with the radiologist to kind of talk about the imaging so that we know exactly what is going on. And that way we can come up with a comprehensive plan. Because with breast cancer treatment, one thing may impact the other. Right? Do I want to do chemo first to shrink it so that I could do a smaller breast operation? Or the patient absolutely can't have radiation because they have some other issues that can't have radiation. So then we have to talk about all of those. And having that cohesive plan, I think, really helps the patients feel secure about what they're
It totally does. I think they love that multidisciplinary clinic and the maternalistic or shared decision making, right? So the patients hear all of their options and they get to know, because there's a lot of interplay, not only between chemotherapy, radiation, surgery, but also your reconstruction and how all of that's going to happen. And certainly in plastic surgery, there is a paternalistic approach that there's one perfect breast. And I spend a lot of time with my patients asking them, like, what is your aesthetic ideal for your breast? Because men all wear the same shoes and hairstyles, and women, we all wear different hairstyles and different shoes, and everybody has a different, aesthetic ideal. And if you're going to have surgery on your breast, you should come out with something that you like.
Exactly. All right, let's talk about the importance of the second opinion. If I have you two, I'm going nowhere else. I'm done. I'm good. I'm in. Is that okay? Or
No, I always encourage patients to get a second opinion.
Why?
Because I think if you hear the same thing from somebody else and you're like, okay, this is the right choice, and then you just want to go with the most comfortable team.
And even if you don't hear the same thing, that's almost better because you learn something different.
Yes.
You walk in and you don't know anything. Maybe you've done a little background research on breast cancer, but it's such an education that you never wanted. And then so you learn a little bit, and then you see another consultant, you ask different questions, better questions, and you keep going. And so I totally agree with Dr. Grumley. I think the more people that you see, it's tiring, it's exhausting, life is busy, but you learn something from every one of those consults.
Yeah. You're also told sometimes, not by you guys, but I mean, friends, don't go on the internet. Don't, research it yourself.
Well, there's some truth to
and
that.
There is some truth to that. So you're right. It is important to go to the source and get the second opinion.
The only thing about the second opinion, though, it can bring up a lot of questions. So I always encourage patients to come back and ask those questions, right? Because not everybody's going to offer the same thing.
Yeah.
We have patients who do go get a second opinion. They're like, well, I wasn't told about oncoplastic surgery, or I wasn't told about intraoperative radiation therapy. And it's not offered everywhere, right? So you have to understand, why is it offered here and not maybe elsewhere? What are the benefits of it? Because, science is moving so quickly. And that's where, you are going to be offered slightly different things at slightly different places based on how quickly they adopt a lot of the new information and the research. We're very lucky here at St. John's to actually have the Cancer Institute associated with it. So we have research going on at the same time. And the close working kind of environment between research and the clinic really allows us to actually look at what are the issues that we're facing today and how can we research that so that we can actually in real time, get some answers, right? Because the thing about research is it always takes years and years and years and years for it to be adopted, right? So intraoperative radiation therapy is a great example of how, research has changed how we take care of breast cancer patients. Intraoperative radiation is a single dose of radiation that can be done at the time of lumpectomy or a partial mastectomy. Most women are treated with whole breast radiation, which takes about 3 weeks to 6 weeks to do, because the thought was that, if you have one cancer, it must pop up in all of these different places. But we are detecting a lot of these lower risk, small screening found cancers, which are not high risk. When we look back on those patients, if it comes back exactly where the first cancer is. So the question became, do we really need to radiate in the entire breast? We probably don't need to do that in every person. We might have to in some because they have a very different kind of cancer. But for most, you can get away with just doing a small amount of radiation, which then saves the rest of the breast tissue. It saves the implant from scarring in the future. And that kind of research came out, the trial was started in 2001. And it's been reported now many times, and we know that it is medically safe in the right patient, but it is not widely available everywhere. So if you are diagnosed with breast cancer, the best advice I can give is, do some research. Figure out where are there centers that are actually pushing the envelope and using some new and novel techniques to be able to take care of cancer.
Right.
And what Dr. Grumley said earlier, you keep asking questions until it feels right.
Yes.
Right? I mean, it is super important.
But it also ties back with what you guys said about the comprehensiveness of St. John's.
Absolutely.
You really got it all the way in there. Okay, this is the fun part for me. So let's talk about you two. Oh my gosh, my favorite topic. Okay, these two are so inspiring. I want to talk about both of your backgrounds because it isn't exactly what you necessarily think. So let's find out what inspired both of you to pursue women's health. Dr. Grumley is an athlete, and Dr. Grunwald is on a paddleboard all the time, somewhere in the middle of the ocean. I'm like, Tiffany, what do you do? Oh, I'm on a paddleboard in the middle of the ocean. Okay. So, you guys are like cool and hip and fun and outdoorsy. And what got you into women's health?
You want to start? You go ahead.
Sure. Thank you for saying I'm cool and fun. Could you tell my children that? Yeah, it'd be great. It's a long path. I mean, I think I started in medicine wanting to do primary care, and then I found surgery, and I loved surgery, and I probably would have been happy doing any kind of surgery. But I really love the patients. I mean, my patients are women from their 30s to 70s, and I develop very close, intimate relationships with them, and that is something that's such a gift in my life, and it makes going to work today every day it's fun. Like I get to hang out with people and find out what's going on in their lives. So, going into the reconstructive part, I really liked restoring things and fixing the problems. And, I get a lot of patients who didn't have reconstruction at the time of their lumpectomy or their mastectomy. And so they've been 10 or 20 years feeling uncomfortable in their body. So, it's a really nice place for me to be. And I feel like I am making a difference.
For sure. Confidence building, self-esteem.
Absolutely.
And I actually remember when we first talked, when I first saw you, didn't even have anything to do with cancer. And you were telling me about some younger women, younger than 30, that had wanted to get breast reduction because it had affected their life so
Absolutely.
dramatically. They couldn't do running or hockey
Sports.
or ice skating or paddleboarding because of such. So, I mean, you really do. You really change their lives in a very
huge
dramatic
difference.
way.
Yeah.
And tell us just a little bit about the Malibu Team Marathon.
I have a breast cancer survivor group. We call themselves the Breast Goddesses. And we do stand-up paddling events every other month, usually for about 6 years. And then for the last 10 years, we've done the Malibu Triathlon as a relay. So everybody does one leg of it. I think a big part, as I mentioned, when you operate on someone, you change the anatomy. And I think that can feel funny as someone's recovering from surgery. So every patient goes to physical therapy at 3 weeks just to make sure that they feel comfortable doing the exercise plan that they want. And as part of that, I encourage them to come paddleboarding or run, bike, or swim with us. Or we do beach walks. This morning, a bunch of us did an ocean swim, and then a bunch of the patients just did a beach walk along the swim to kind of cheer us along as we came out. But, I think that part of feeling strong and confident in your body isn't really just about making breasts. It really is about being a community and the women supporting each other and doing something that's hard.
Yeah. I didn't want to get back into life. I did what I needed to do. I had my surgery and then I went right back to work. But then I came home and you're just kind of like,
uncomfortable.
no, yeah, I just wanted to protect. And so it's so valuable to do that. I love that. Dr. Grumley, so you're an athlete, and what lessons did you learn from being an athlete that you kind of transcribe into doing what you do?
Well, so I, thought about medicine just because, I think almost every Asian child is taught to think about medicine, right? But I was an athlete and I was a figure skater, and that was kind of the thing that I thought I was going to be. But then I was injured. I think just as I was about to get into college, I think it was 18. So I was thrown at doing a pairs throw and broke my leg. And I just remember profoundly having to go see an orthopedic surgeon. And, obviously he's like, yeah, we need to operate on you, and just walked out the door. And then I, of course, was in tears. I called my coach and he's like, no, we're going to get you a second opinion. Let's figure this out and let's, figure out what you actually need. So we got the physician for the Edmonton Oilers, which is like the hockey team. Yeah. And so he came over, he sat down in my bed and showed me the x-ray, explained everything, and told me this is going to be fine. All we need to do is put a little pin here, and then you're going to be out for a couple weeks, and then we'll take the pin out, and then you should be able to skate and we can rehab you. He just went through that whole, discussion with me and treated me like a human being, which made such a difference. And I think that's what kind of made me more interested in medicine, because it was like, okay, it was that dichotomy of like, yeah, it was
Contrast. That's a great
huge
story.
Yeah, that is.
of what it could feel like, when you don't give the patient the time of day versus being able to sit down and actually talk to them about what is going on. It's that fear of the unknown that's most anxiety provoking. And that's absolutely true in breast cancer, right? So people wonder why I spend so much time actually walking through exactly what the diagnosis is and some of the biology of it, because people want to know, how did I get it? Why is it that I have breast cancer versus, this other person who doesn't? So we talk a lot about, how that happens and build that rapport and build that, have that discussion so that people understand what's going on. And I think that's really important. That's what I love about what I do. I actually thought I was going to do every other surgery but breast.
Really?
I thought it was one. I mean,
They're all fun.
They're all. The thing is, in surgery, you want to go for the really sexy operations, right? So you want to do trauma and you want to save lives and you want to have blood and guts everywhere. But then you realize that, once you finish that, you don't have any relationships with those patients, right? So I think it was by the time I was a third year resident that, I met my mentor, Dr. Silverstein, who did oncoplastic surgery. I remember very vividly, sitting at Grand Rounds, having him show pictures of what mastectomies looked like before, what lumpectomies looked like before, and how he's transformed things with oncoplastic surgery and how we can actually do things differently for women. I just thought he was such a forward thinker, and it seemed like if you do a good operation, you have a huge impact, not just on the cancer, but how they feel about themselves for the rest of their lives.
100%.
And so that connection, I think, really drew me to breast oncology. And a great example of this was just yesterday, we had a young breast cancers event. So first time we could actually meet in person. We had a lovely garden party, and we had all of our women who are younger, who have been diagnosed, come out, and we actually had a talk given by Dr. Cheryl Ross about estrogen afterwards and how it feels and the sexual function afterwards. So it was a great afternoon, great gathering to have all of these people who have gone through such a difficult thing. And the icing on the cake was that one of my younger patients, she's in her 20s when she was first diagnosed, and we treated her. And she couldn't come to the event yesterday, and we were all very sad she couldn't come because she was getting married. Right? It's those family events that you get to share and you hear all about, I've moved on, that horrible journey is behind me, and I've actually moved on to the next chapter. And so we all toasted her. It was just such a fantastic moment. And that's when, you sit back and you're like, this is why I do what I do.
Wow. I love that story. Yeah. And little personal note, Dr. Sherry Ross was the one that I went in for a regular mammogram, and she's the one
she's
that
amazing.
detected.
Yeah.
So it all comes back to St. John's.
Yeah.
It really does.
It's a great team.
Talk about comprehensive. Yeah. It really, I love that, and that is so true. It really is. So let's talk about what inspired the Women's Health and Wellness Institute and your motto, Dr. Grunwald, by women, for women. Tell me about that.
Well, and it's a little bit about what we've been talking about, right? But, the concept of a comprehensive Women's Health Institute has been around for decades at St. John's, and I just took up the charge a few years ago. But we have so many things that need to be done every year. Mammogram, colonoscopy, skin check, cardiac health, cognitive health as we age, right? All of these things. And it just becomes overwhelming, whether you're working or a mom. And so really trying to ease the patient's way as they try to navigate through all of these services. And we have amazing institutes and physicians at St. John's, really world class. And we do have a good community among us, but sometimes it's hard for the patients to get access to all the services that they want. So our goal is to try to help the patient decrease the friction of getting all of their healthcare needs, so that, if you're going through breast cancer, oh my gosh, I still haven't had my colonoscopy, or, my mom had heart problems as she aged, that then we can kind of shepherd them through and make sure that we're paying attention to the full spectrum of a woman's healthcare.
Sure, absolutely. Last question. You guys have been amazing, and I don't want this to end. Dr. Grumley, what distinguishes St. John's Health Center in the area of women's health? If you had to say what really distinguishes, what would you say?
I think it's the people. I think St. John's attracts a very special type of physician, right? So somebody who is really there to take care of a patient. It's not about egos. It's not about how many letters behind your name. It's not about, a position. It's about taking care of the person that's in front of you. A lot of my patients have said that just walking into St. John's, you can feel the difference, right? It feels like I'm a person, not a number. I'm seen, and every single physician is so great with working with each other. It's that collaborative effort that I think makes a patient's care that much better, right? So it's everything from research to the nurses to the administrative assistants taking care of like everything, every step of the way, the preoperative nurses, the postoperative nurses, and the feel that you can communicate with anybody, right? Anybody can just be like, hey, I'm going to just call Dr. Grumley because I'm worried about this. And I love that ability to communicate with each other. And so I think the patients feel like they have our arms wrapped around them and we've got it. We're going to take care of you and we're going to make sure you're going to be fine.
Wow. Well, this wasn't planned, but you set me up perfectly because
Wow.
you are exactly right about the doctors and how they care so much. One of the doctors here, Dr. Grunwald, gave this to me when I was going through my treatment, and she had this made for me. And what it says, for those of you listening, is she overcame everything that was meant to destroy her. And I keep this on my bedside table and I look at it every day, and it's from my doctor, Dr. Grunwald. And, that's the doctor-patient relationship that you just talked about. And I think it's a great message for all women, actually all patients, that, whatever we have to deal with and whatever might feel like is sent to destroy us, that we can overcome it with doctors like you two and places like St. John's. So thank you both so much for being here, Dr. Grunwald and Dr. Grumley. You guys are amazing. And this, just trying to keep it together through this was a very interesting interview for me, but I adore you both and I thank you both for what you do. And I want to thank St. John's Health Center Foundation for making this possible and getting this information available to all the community. Because as Dr. Grumley said, we don't want to be the best kept secret in town, right?
No.
There's no secrets in Hollywood, but this seems to be one of them.
Yes.
Anyway, and thank you to all of you for joining us. So until next time, I'm Kim Douglas with your Healthy Dose.